Hi, everybody. We're continuing our discussion on the coronavirus or COVID-19 pandemic. And if you've been keeping up with the news, you know the numbers are multiplying at an alarming rate. We hear about flattening the curve and a forthcoming plateau. But what does that mean for us here in Central Florida? On this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Now let's get an update from our local medical professionals. Residents and visitors here in Orange County are asked to stay diligent with their health and hygiene. And joining me are Dr. Christian Zuver, the Orange County EMS Medical Director, and Dr. Pino, the health officer with the Florida Department of Health in Orange County. Thank you both for joining us. Dr. Pino, we'll start with you. What are the coronavirus numbers here in Orange County right now?
So our numbers are exceeding, and these are a cumulative number, over 1,000 people with the disease. We have 21 deaths occurring in our county, 3 added yesterday or before yesterday in total. And we have tested over 12,000 people in the county. Those are the numbers in general, kind of brushstroke.
And for the testing, are we finding that we're seeing a larger number of people who are showing up who are asymptomatic?
We have, yes, the short answer is yes. The role of asymptomatic people has been increasing and in what role they play in the pandemic. And we probably will have better data at a later time, but the numbers, although we continue to increase the number of tests, the rate on which we are getting positive tests back is declining, which is a good indication that the pandemic may be slowing down in Orange County.
Now, the federal government is no longer operating the testing sites. Many states, including Florida, have agreed to run them. What is different about having the federal government do the testing versus having the state do the testing?
So there's not much difference on the operation. In many instances, always the federal government with more resources and expertise in some cases come and set it up activities and then hand it down for those to continue and transition into state hands. And that's probably what happened in this case. The difference is not much, except the fact that the state has increased the number from 250 that the site was performing a day during federal management to about 400, 500, depending on supplies that they can do daily now.
And Dr. Zuver, we have this question that comes up all the time. Who should get tested?
Well, I think the most important subgroup of patients to test are those who are symptomatic, those who have comorbidities, or those who are elderly. No question, those are the ones that we really need to know what's going on with them. I think as testing becomes more easily obtainable in the region, well, then we should expand that to have a more broad criteria. I mean, in a perfect scenario for both public health purposes and for tracking, we would know what everyone's status is in the region, but we're quite away from being there yet.
And what is the current status on wearing masks? Because we know that Osceola County has started to require them. Dr. Zuver.
Sure. The CDC recommends that everyone who's out, on top of the usual social distancing, when you have to be out, that you wear a face covering. And I think the distinction needs to kind of be made between wearing masks and wearing face coverings. I think the general population, a face covering is appropriate, and that could be something made of cloth. I think for healthcare providers, ensuring that the surgical masks and the N95 masks remain available for them is essential. But we do recommend that if you're out, if you have to go out right now, that you do wear a face covering.
And Dr. Pino, where are we in getting the antibody tests and making it widespread for people who either have had or think they have had the coronavirus, or for people who have had some symptoms they're not sure?
So we don't have any antibody test going on right now, at least in Orange County. The machine has not been distributed. We understand that it could happen pretty soon, and that could be a game changer because it's going to be at the point of dispensing care, so the results are going to be rather quick. Part of the issues that we are facing with this pandemic is that we are running behind. We are always playing catch up because of the type of testing that we have. If you test someone, if someone acquires the disease today, you develop symptoms in 5 days. You may test the person 2 days later, but then it takes 3-4 days to get the results. But the end that you are able to contact an individual, they have contaminated hundreds of people, and that's why it has evolved so fast, so quick. The role of testing have to change. It has to be a preventable tool for transmission and accelerating case investigation and tracing so that we can prevent expansion and penetration of the pandemic in the future.
And Dr. Pino, have we made any steps toward contact tracing so that we can start to get in front of the disease, so to speak?
Yeah, we do have contact tracing, and a department in Orange County is quite sophisticated at the state level for this type of work. We, due to the sheer amount of cases that we are receiving, we have concentrating our trace investigation in pockets that we consider to be more critical for preventing efforts, and that includes healthcare workers, which we have to keep healthy and able to respond to this crisis, first responders, including EMS and firefighters and police, also homeless population and people who are living in assisting facilities, and those get priority for trace investigation.
And Dr. Zuver, if someone were to test negative, what are the precautions that they need to take in order to stay that way?
Well, I tell everyone that tests negative to act like you have COVID. So you should still be staying home. You should still be wearing a mask. You should be practicing really, really good hand hygiene and social distancing. So just because you're negative, if you want to stay that way, the best way to prevent it is to act like you have it.
And Dr. Pino, if you were to give any advice to any residents right now, because things are changing all the time, what would you tell someone right now about this disease and about what they should be doing to either protect themselves or their loved ones?
So, we have started talking about restarting the economy. We have start talking at the national level about lifting some of the limitations that we have in place for human contact and closeness. And my advice to everyone is we may have to continue to practice some distancing and being careful and mindful until we have a vaccine. Until we have a vaccine for this disease, more likely it will have a recurrent cycle that we are learning. It's a new disease. We are learning how to fight it. We are learning how to prevent it. But until we have a vaccine and we build the immunity of the herd, we may see some cases.
And Dr. Zuver, we're told that for hygiene, of course, we're supposed to wash our hands after we touch surfaces. How about things like, groceries? Do we need to disinfect those before we bring them into the house? How does that work?
I recommend wiping down any groceries or supplies that you bring in. I think that it just is one more step you can take to ensure you're protected. We know that the virus can live on surfaces for variable periods of time. So disinfecting your groceries and supplies is another technique you can use to help decrease your risk.
Well, Dr. Pino, Dr. Zuver, thank you for keeping us informed from the front lines. We appreciate your work.
Thank you, sir.
And stay tuned for more informational segments coming up. This outbreak of the coronavirus may be stressful for people, and fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. So let's learn how to cope with stress. And joining me is Dr. Phil Toal with Aspire Health Partner, and he's here to tell us how we can get through these very trying times. Dr. Toal, thanks for being with us.
Thank you for asking me.
So how does something like the coronavirus take a toll on us mentally?
There's a number of different ways. First and foremost, to remember is that this is the first time in the history of mankind that we've had such a issue, one that's worldwide and affecting every single person on the planet. That in and of itself has increased the stress and anxiety. In addition to that, it's important to remember that we are in this together, that none of us are alone and none of us have to be coping all by ourselves. Having said that, however, given the fact that we are isolated to our homes, most of us, and only those that are essential workers can leave the home, that's becoming increasingly stressful as the days grow in number with the isolation and the staying at home. Stress and anxiety is increasing. So it's important, first and foremost, I think, to remember what is it and what are the signs and symptoms that tell you that your stress and anxiety are increasing. So being able to recognize the changes in your own body, increasing levels of physical and muscular tension and stress, behavioral ways in which you might experience stress, becoming perhaps short-tempered, becoming more disengaged from activities with the family, feelings of being blue, and increasing feelings of isolation and aloneness are certainly signs and symptoms. So recognizing when your stress and anxiety are increasing, then beginning to engage in some of those coping strategies that we all have and have used over time, but making sure that we're engaging in those on a regular and consistent basis. Paying close attention to how we identify the ways in which we can interact with ourselves to reduce that stress. That also includes taking some time by ourselves. So if you are being quarantined or isolated with family members, making sure that you find time for yourself as well.
So how do we avoid letting the fear that we have about this virus turn into paranoia?
I think that's a really important point to make. First and foremost as well, we want to make sure that we're informed about all the data, the statistics, the facts, to make sure that we're keeping ourselves safe. We also want to make sure that we have a balance with not being glued, to social media, not being glued to the news. We frequently find that, particularly here in Florida, when there's a hurricane, and we might find ourselves glued to the news and watching the tracking, and is it going this way, is it going that way? Well, we're finding the same thing with COVID-19. The difference with the hurricane is that within 48 hours the hurricanes come through. Now we may have to pick up some things, and deal with the damage afterwards. This is ongoing. This is uncertain. This is we have no idea how much in the future this is going to take us, and so that building up over time is becoming increasingly problematic for people. So really disengaging from social media, disengaging from the news from time to time. Yes, you want the information, so creating that balance is very, very important.
A lot of people say because of this virus, things will never be the same. How do we deal with this new normal that we're probably going to experience coming in the future?
That's a very good question as well. Spending some time with ourselves to think about what might that new normal look like. For instance, do we see ourselves going into public wearing masks, on an ongoing basis in the future, much like they do in some of the Asian countries where you see them in public without a breakout of any kind of pandemic wearing masks? Does that become a part of our new normal? Ways in which we greet one another. Is the handshake going to go by the wayside so that we're decreasing physical contact with one another unnecessarily? So really think about what that might look like, and as importantly, then think about what might be some things I do put in place that allow me to have that connection to people. For instance, one of the great things about technology is that we do have social media which can work against us and can work for us. But reaching out to people, I'm hearing frequently people saying, I've been talking with friends now that I haven't talked to in years. I'm engaging more frequently with family members. So even though it may be through a computer screen or an iPad screen, we're actually having more contact with one another. And so that's positive. So individually thinking, how does this look for a family, what that might look like in the future? How do we engage in interactions with others, in social activities and in leisure activities when there may be some limitation as to social distancing?
Because of social distancing, a lot of people are losing loved ones and friends and really not being able to say goodbye to them. And then there are the life milestones that birthdays and anniversaries that are just not the same. How should people deal with those?
Those are a couple of very important questions. First and foremost, particularly around the sense of loss and grief in relationship to perhaps a loved one that is dying from COVID-19, and the inability to be present and not even be able to hold a funeral or a memorial service. So I would highly recommend that we do something very individual that might allow us to express that sense of grief and loss, to be able to say our goodbyes when we can't do that physically, but to be able to do that with perhaps a ritualistic way of perhaps writing a letter to the loved one, sharing that message again through social media with others, posting a Facebook mention to say, identify, here's what I've experienced, here's what I'm going through, and these are my feelings. The expression of our feelings is really important during this period of time, to be real about what we are feeling and our fears and our anxieties, but also recognizing that when we do so, that's helping to support us. As far as milestones go, anniversaries, celebrations, milestone birthdays, again, using social media and those kinds of strategies, hold those Zoom parties, if you will. I know a lot of people are having a Zoom get together to celebrate birthdays, and while you can't be physically present, you can be present on screen, you can be present verbally, and share. Pick up the iPad and pass it around, and let's see everybody that's in the room show off the birthday gifts that are there, or even pictures of birthday gifts that one might want to receive, and continue the celebration, albeit in a distance sort of way. Acknowledging those milestones are very key, because that's what helps create some degree of normality. We certainly can't believe that there's anything normal about this experience, but what's really key in the way to reduce stress and anxiety is creating some degree of normality in our lives. So sticking to some kind of routine. So honor those birthdays, honor those anniversaries, celebrate those experiences that we're having, like Easter, for instance, that just recently passed, and Passover. Recognizing that it's not going to be what it used to be, but we want to have some degree of normality. Don't let those go by the wayside. That's one of the things that's going to increase stress and depression and anxiety and depression, is that if I'm ignoring those kinds of things or feeling so isolated that we can't celebrate.
And you mentioned technology. Tell us about the resources, the mental health resources that are available on Aspire's website.
A number of things can occur. We're 24/7 available for clients, and kind of break things down into existing clients that are already in treatment, that are managing their illnesses through medication, through counseling, through other services. Those are all still available for clients, and interacting via telehealth is readily available. For clients that may be, or individuals recognizing issues that they might have had come to the surface anyway without COVID-19, can still access services and reaching out. And then those that may be having increased mental health and substance use issues related to COVID-19. So reaching out to our call center at 875-3700 and hit number 2 will take you to our call center, who will do the immediate assessment to determine what services are necessary. All of our outpatient services are being provided via telehealth, so they're still fully available to clients and to new clients. We're just doing that remotely via telehealth and doing those full assessments and providing those services, including our medication clinics. So our psychiatrists and our nurse practitioners are assessing those clients and making recommendations about medications, et cetera, via telehealth, and providing those to the pharmacies to deliver the medications, as well as our acute care, including our inpatient psychiatric facilities, crisis units, our residential treatment programs, our detox facilities are all open, and the clients are coming in, being assessed, and being placed at the appropriate level of care. So the services have not been altered in any way to reduce the numbers, just altered in the way in which we're delivering that service, with the exception of the acute care, which is all still on site.
Well, Dr. Toal, thank you for being with us today, and thank you for all you do during these trying times.
Well, thank you.
And we'll be right back with more. While people across the country shelter in place, work from home, or even temporarily close their businesses, first responders and healthcare workers keep showing up to work, serving their communities and putting patients first. Joining me is EMS Battalion Chief Scott Egan with Orange County Fire Rescue, and he's here to tell us how first responders are dealing with the coronavirus pandemic. Thank you for joining us, Chief Egan.
Absolutely, thank you.
So how are personnel being enhanced, anything around them being enhanced to deal with this pandemic since they are the first responders?
Oh, well, we have several layers of enhancements underway. It starts from the first 911 call coming in. There's some additional screening taking place there, all the way down to our crews have additional personal protective equipment for them, and also for the patients that we are there rendering care for.
And are there extra precautions being taken for personnel who are interacting with the general public?
Absolutely. Those personnel have additional safety measures in place. First, they will talk to the family before making entry to the house. And then once they make contact with the patient, we will usually put a mask on the patient, and our crews will be already wearing their additional protective measures before arriving to the scene.
Now, is the PPE, the personal protective equipment, is that the only thing that's being used to help stop the first responders from themselves being infected with the coronavirus?
No, we also have additional safety measures in place. After the call is completed, we have a decon procedure to clean our equipment and our units. That also involves some new technology using the aeroclave system, which is aerolization of our cleaning agent that is used on the transport unit. And this will help make sure that there is no cross-contamination to our healthcare providers or to the patients that we transport after the previous patient.
And I'm sure that emergency personnel are working long hours. How are they managing stress?
Stress is something our personnel are trained from day one in their training back at the fire academy or in EMT or paramedic. But we've also taken additional steps. We have activated our department operations center, which interacts with our crews in the field on a daily basis. We also have a family hotline for our crews or the families of our crews to contact for additional resources if they need them.
Now, for the general public, should they expect something different if they were to call emergency personnel as far as how they would be treated as a potential patient?
Absolutely. When they first dial 911, there'll be additional screening questions that are not normally asked. It might be if they've had a fever or a cough or anybody in the house has had those. And then those additional questions will be rescreened when we arrive to the scene as well.
And so finally, what kinds of things would you tell the general public, our residents of Orange County, about things that they can do to help these first responders help them?
First is call 911 when it is an emergency, and consider that first. If it's not an emergency, we recommend that they contact their primary care physician to find out what they recommend. Also, if they're able to step out of the house to meet the crews, that will also help reduce the exposures to their family members by our crews or interact with them. And then last is just personal staying at home. That message cannot be repeated enough that we're asking everyone to stay at home to minimize the exposures and then to continue the good hand sanitizing and or hand washing procedures as well.
All right. That is Battalion Chief Egan. Thank you for being with us, and thank you to all the first responders who are helping us through these trying times.
Oh, thank you. Thank you very much, Clarence.
And we'll be right back with more. There are countless organizations trying to fight this virus by doing what they do best, serving our community. Joining me is Susan Forbes of OneBlood, and she's here to tell us more about what they're doing to help during this coronavirus pandemic. Susan, thank you for being with us.
Oh, you're welcome. Thank you for having me.
How is OneBlood helping residents during this very trying times that we have now?
Well, right now, one of the main focuses that OneBlood is very focused on is the need for people who've recovered from the coronavirus to come forward and be a potential candidate to donate convalescent plasma. And that is something, a new therapeutic treatment option that has been made available by the FDA. As it's an experimental treatment, but the FDA has given emergency permission for it to be used with people who are critically ill with the coronavirus. And basically it all comes down to antibodies, and by transfusing the plasma from people who have recovered from the coronavirus, they've developed antibodies to that virus which remain in the plasma portion of their blood. So by transfusing their plasma into a person who's still fighting the virus, it can potentially help boost that patient's immune system and potentially help them recover. So we're very focused on trying to get people in the door who have recovered from the coronavirus to see if they meet the eligibility to be a potential COVID-19 convalescent plasma donor.
Now, are we actually allowed to donate with the stay-at-home orders in place right now?
Yes, donation is allowed. We're considered an essential service because we're providing a life-saving product to hospitals 24/7. So we are able to continue our operations, and we also, donors are able to come in to donate. And we've implemented additional safety measures in light of social distancing. So we've moved to appointments only to allow only a certain number of people at the blood center at any given time, as well as on our mobiles. And we are that by having the appointments also, it enables us to bring in the right amount of blood each day to ensure that we are meeting the hospital demands.
Has this pandemic and the stay-at-home orders impacted OneBlood's the blood levels that you have available right now?
Well, a couple of weeks ago, back in March actually, whenever we started having businesses and schools closed down, that started to impact our operations, our ability to collect, because that's where we go to have blood drives. So as schools and businesses closed down, we were losing blood drives very rapidly, really at an unprecedented pace. We've never seen anything like it. At this point, we've had about 3,000 blood drives that are canceled through May, and that would have accounted for over 50,000 blood donations. So when they started to close down, we put the call out for people to come in to help, and our donors responded very quickly, and because of their fast response, they helped boost up the blood supply and put us at a very stable level. So now we've moved to that appointment only, and people continue to make their appointments, and we're having donors come in on a regular basis. So it's been very good. And that's what we really encourage, is it for people to make this a habit. Book your appointments each and every time you are eligible, and by doing that, you're helping ensure a ready blood supply at all times.
If someone is interested in donating, how do they get in contact with OneBlood?
Everything really is at oneblood.org. That's where you can make an appointment to do a regular blood donation. It's and platelet donation as well. It's also a location where you can go to get all the information about being a potential COVID-19 convalescent plasma donor. So if you're a person who's recovered from the coronavirus, you have this potential to help other people who are still fighting the virus by donating your plasma. So that is a real urgent call out to those people. Those people who have recovered from the coronavirus really are just now becoming eligible to be able to do this, and it's really about creating awareness that this is a new donor pool that we're looking for here to build additional inventory of COVID-19 convalescent plasma donors. So we really need them to come forward, supply the information that they need to provide back to the blood center that the FDA is requiring to be provided to us, and then we will see if they meet the eligibility and get them scheduled to donate very quickly.
And also for people who just normally donate blood and are interested in doing so, but aren't sure whether this is a good time because they haven't had coronavirus, what would you say to them as well?
I would say if you're eligible to donate and meet the criteria to be a blood donor, reach out to OneBlood and schedule an appointment. Blood is needed every day to help patients, and even, doesn't matter what's going on in the world, blood is needed. And being in a pandemic situation really only heightens the need for that ready blood supply. So as people are eligible to donate, we encourage them to reach out to us. If they meet the eligibility to be a blood donor, then we're going to schedule their appointment. And for people who meet the eligibility to be a COVID-19 convalescent plasma donor, we're going to schedule those appointments very quickly as well.
Well, Susan, thank you for being with us, and thank you for OneBlood and all you do during these trying times that we're experiencing right now.
Right. Great. Thank you very much. We appreciate it.
We've heard from a variety of leaders today trying to keep you informed about the coronavirus, from local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. We are also here to help you keep making those healthy connections. Stay safe, everyone.